Here we go. 12 o'clock. Just like that, 12 o'clock live. And here we are, ladies and gentlemen. Welcome once again. Happy Thursday, 12 o'clock, lunchtime, noon. That means we get to have another conversation with a client today. So my name is Dave Saunders at Madison+Main. Welcome to Convos with Clients. Today I have the special privilege of introducing to you the president of the Virginia Association of School Nurses, Gina Bellamy. Gina, how are you?
I'm great. How are you, Dave? Thank you so much for having me on.
There you go. I give you the sound machine. Yay! Welcome.
Thank you. Thank you.
You know, we talked a little bit before about, we were right before we went on, we're talking about the new normal, and the new normal is we have to do things on Zoom. And so, like if you were speaking to an event, you'd hear people applauding, right? You would hear, you get to see people's faces and stuff. Unfortunately for you, Gina, you have to look at my face today for 30 minutes as we do this. That's not very good for anybody, I tell you. And I don't know who had this crazy idea of putting this big mug on Facebook. But anyway, welcome to Conversations with Clients. This is our 13th. This is our 11th. I'm getting the signals from the guys that really know behind the scenes. Socially distanced, 6 feet away from Derek Fair.
Absolutely.
Who's always there. The 11th version, of Conversations with Clients. Yeah, just time flies, right?
Yes, it does.
Gina, help me with this. This is awesome. So I know what an RN is because my mom, who's probably watching at home in beautiful downtown Summerville, South Carolina, is a retired RN. She is a retired school nurse. In fact, she was the first school nurse in Amherst County, Virginia. And for a long time, she was the only school nurse in Amherst County, Virginia. And she had to go and do vision and eye testing and hearing testing for every single student in the entire county. It's a good thing Amherst County is not that big. Today, I know that they have school nurses in a lot of different schools out in Amherst County. And many places in Virginia have school nurses. And we're going to talk about that. And because there's an association and you're the president. Yes. But let me ask you first, Gina Bellamy, MSA, BSN, RN, NCSN, you've got an entire alphabet behind your name. I know what RN is. Tell me the rest of them.
Okay. MSA stands for Masters of Science in Administration. I received my master's degree back in 2003 with a subspecialty into healthcare administration, like if healthcare administration, like a hospital or an acute care facility or a nursing home, anything healthcare related. RN, BSN, well, before you can get your graduate degree, you have to get an undergraduate degree. So I received my Bachelor's of Science in Nursing degree from University of Alabama. I'll just throw that out there.
Roll Tide.
Thank you. Way back in the 80s. And then, as I stated earlier, went on and received my master's degree. Now, the last acronym is for National Certified School Nurse. In many professions, especially health-related professions, nursing professions, and medical professions, each subspecialty has a board that is highly encouraged or recommended that you sit for this particular board. For instance, pediatricians have a pediatric board so that they can earn their certification in their subspecialty, which is pediatrics. Surgeons have the same thing. So you see all those long initials behind the physicians' names. That represents that they sat for their board and passed their board successfully. So I am a national certified school nurse.
Awesome. I appreciate that. That's fun to go through and you see all those things. When Dave Saunders, like BA, Bachelor of the Arts, English major, not very impressive. So I just don't even put it behind my name, but that was an impressive lineup of letters beside your name. And I know that you worked hard to earn all those certifications and degrees. We're going to talk today about Virginia Association of School Nurses. One thing, even though the viewers here on the Convos with Clients may be new to the Virginia Association of School Nurses, and you may have heard about it, today or very, very recently, The organization's been around for 36 years.
That's right.
Tell me, I know you've been involved with it for a little bit of time, right?
Right. I've been a member of VASN uh, since 2000. That's when I transitioned from, I was a Navy nurse. That's how I started my nursing career. I was a Navy nurse. So that's how I transitioned into student health services back in 2000. So I've been a member almost 20 years. I just was elected president last year. So this is my first year at the helm.
Right. Well, one, I'm glad that you're the president because we got a letter from you. We got I think 6 months ago, right? Maybe
Yes.
6 months ago. And we got a letter saying, you know what, we're trying to do some really cool things this year in terms of our image and our marketing and our advocacy. And it's a pivotal year from us. And we could use some help from an agency like Madison+Main. And we were happy to do it. One, because my mom's a school nurse,
Yeah.
and my kids went to public school, and I had a great relationship with the nurses there. I had one child that was a frequent flyer that used to be there a lot at the band, and I had another one that went, I don't even know who the school nurse was, right? So
Right.
the two of them kind of different levels of access to the school nurse, different levels of care. With right now, in the last 6 months, we've been helping you guys with some stuff. And by the way, it's been a pleasure to work with you guys. More recently, in addition to some of the branding and marketing and strategic things that we're doing, we're really involved in PR right now because lawmakers are meeting nearby.
Yes.
And there's something on the agenda. It's an active bill on Capitol Hill that we're trying to get made into law. Tell me about that. What is that right now? Tell me about SB. Is it 5004?
That's correct. That's
Yeah.
correct. Senate Bill 5004 was brought to the General Assembly by Senator Keegans out of Virginia Beach, the Virginia Beach area, and she herself is a nurse. She's a nurse practitioner.
Okay.
The bill was brought forward. The bill actually is mandating a school nurse, an RN, to be in every school building in the Commonwealth. There's actually two parts to this bill. One is that the school nurse, and this is very important, is that the school nurse is defined as a registered nurse. Okay. Previously, anyone could be a school nurse. There was not, VDOE, Virginia Department of Education, did not define what a school nurse could be. So a school nurse or someone acting as your school nurse could be the secretary in the main office, a teacher assistant, a parent volunteer. It could be anyone. Okay. Not that those people didn't do the best that they could, but our school children in the Commonwealth deserve a professional school nurse. That's one part of the bill. The second part of the bill is that each school in the Commonwealth have an RN on board. And this is especially important now. As everyone knows, we're in the middle of a global pandemic.
Right. Yeah. I remember. So I was surprised when we first moved back here to find out that there were not school nurses in every single school.
Right.
That you're right. There was an assistant or an aide or somebody in there that helping because, and then when Chesterfield, I think a few years ago where my kids went, they went to having some school nurses in, but then it seemed like there was one school nurse for like 4 elementary schools.
Yes.
Now, how do you have one school nurse for 5,000 kids? I mean, is that really kind of the kind of care that can a school nurse serve that many kids?
Not well.
Yeah, I would imagine. Yeah.
No.
So it was important for that distinction. You said that it provides a school nurse in every school, and
correct.
Two, that there be a registered school nurse.
Absolutely.
Well,
absolutely.
Hold on. So now let me think. So let's see. That number one makes sense, and number two makes sense. So we should have 140 to 100 to 1 in the Senate, right? Or excuse me, 40 to 1 in the Senate and 100 to nothing in the House, right? This should be unanimous in my mind.
I believe so. This is a bill that is beyond partisan politics. It should be universal. This is not our first rodeo bringing a school nurse bill before the Senate. This is probably our 6th or 7th one. And we've had Republicans and Democrats alike bring this bill up. Unfortunately, it's never made it out of committee or subcommittee.
Wow.
Now,
Okay.
I
So
want to
what
talk.
committee is this in front of? This is the Finance and Appropriations Committee?
Yes, the last I heard, the bill this year was voted unanimously out of Health and Education Committee into a finance. Well, let me do. I will say the gentleman, the senator from Fairfax City, did abstain. But other than that, it was 8-0.
Okay,
vote.
good. Now let me ask about this. So, 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 um, so it's in. So we made a little progress this year. So we got it out of committee.
Yes.
It's
Yes.
coming up, and it's a special session.
Yes.
Now, a lot of clients I talk about pre and post COVID. So let's talk about the situation in school systems, right?
Okay.
Pre-COVID, all right, was it? There must have been some sort of attitude here, maybe that there's some sort of lack of need, that the people that were serving in this capacity could fill that need. But as we know, students have many different health concerns. An RN is not just there to hand out aspirin and put Band-Aids on knees, right? I mean,
Yes.
tell me about some of the things pre-COVID that RNs were doing for kids in schools.
Okay, I'll be happy to, Dave. You're absolutely right. We have a saying amongst ourselves, we are way beyond Band-Aids and boo-boos. School nurses are one of the most misunderstood occupations in the educational institution. There are so many students coming into schools now because of IDA, the ADA Act, American Disability Act. So there are students coming into schools that maybe 20 or 30 years were not coming in, and they have very complex health conditions and may require very complex medical procedures. So that is why a professional RN is needed in the school. These are procedures that would be done, let's say, in a healthcare facility that will require an RN to do. Why in the world would we deem that it's okay to let an unassisted personnel or person do it in the school setting? That student still deserves top-notch nursing care,
Right.
especially in our school system. One of our jobs is to let parents know, because I don't believe parents and stakeholders in the Commonwealth understand that not every school building in the Commonwealth has an RN.
Right. Yeah, and that's kind of surprising to me too. The fact that I would say that not every school had one, or that even if and made an advancements there, that there'd be one nurse for like 3, 4, 5 whatever schools. I think. Do you think before COVID there was an idea that children in school really only needed kind of emergency services, that the nurse or whatever the person there would be kind of a conduit between that and EMTs? Or what do you think the thinking was that said, you know what, we don't need a qualified licensed RN in a school. We need more of a caretaker role.
I think you're right. I think some people did think that if anything bad happens, we'll just call 911, or if the student is sick, we'll just call their parent or whatever. But what VASN tries to explain to parents and to stakeholders is, if you have a professional nurse there, we can assess, which unlicensed personnel cannot do. We can assess your child. We can decide if your child is, let's say he's an asthmatic and he comes in, we will take out our little trusty stethoscopes. We will listen to your child's lungs. We'll auscultate lung sounds, and we can determine by listening to your child's lung sounds, okay, little Bobby needs his inhaler in rest and he can recover. We'll listen again and we can send him back to class. Or little Bobby, we need to call mom and dad, or we need to call 911. Most of the time, it's the former. So that student gets more instructional time. When you have unlicensed assisted personnel there, they're going to call mom and dad, and little Johnny's gone home.
And the backside of that too, let me play devil's advocate here too. Let's say that you have a licensed professional school nurse, an RN, that can assess little Johnny,
Mhm.
like your analogy here. Listen to little Johnny's chest, figure out what's going on with him because he has asthma. One, they can find out too if they need to call mom and dad, so little Johnny has more instructional time. But
Right.
I wonder how many unnecessary 911 calls are made from schools across the Commonwealth. If you
Mhm.
think about every little city and town, and they go, I don't know, I'm not qualified, I'm just going to call them. I
Mhm.
wonder what kind of a burden maybe that puts on local EMTs and local um, 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 emergency service providers.
That's a very good question. We don't have the data to show that, but you know, I would encourage any unlicensed personnel if they are observing a child and they're not sure because they're not nursing personnel, they're not medical personnel. It's never wrong to call 911. We
Right.
all want to err on being conservative because this is a child's life. So
Agreed.
make the call.
And I think that maybe on the converse of that, I wonder how many didn't actually understand the difference between calling 911 when they should have, you know?
Oh, absolutely. Absolutely.
So I think,
Because they're not trained to.
right. And I think that that's part of it. So that training and that educational level of that frontline school nurse,
Mhm.
I think, is making the argument there. To me, that just makes it more of a no-brainer in my mind. So we we're looking at a couple of things here. I know that you've made the rounds talking.
Yes.
You've been doing some interviews and some different things. Tell me about what that process is like, kind of being in the job, working with school nurses, and now being the advocate for the association. Has that been fun for you in the last few weeks?
Oh, it's
I
been
know you're
absolutely
passionate
fun.
about it.
And let me just say, Dave, your people, your staff have been wonderful to work with.
Oh, thanks.
Allison, Kent, and now Derek, they have been spot on. They really have. And the reason that VASN and this bill has gotten so much attention is directly related to Madison+Main support. And I just want to thank you for that.
Well, I appreciate that. You know what? Mr. Brockwell, Kent, he's over here. He's blushing. I can't tell
Oh,
the beard. Like you can't see it like underneath the beard, but I bet he's blushing. He hears you too. He is socially. He
yeah,
says, "Thank you, Gina. That was really nice." And I know on behalf of the entire team, we appreciate it as well. We take a vested interest in our clients, and we want to make sure that we're pushing that forward too. So we're happy to do it. Like
great.
you said, for us, it's a no brainer, and let's hope that this seventh or eighth try. It's already further down the road. Let's hope
Right.
it does. Let's keep going with that. I would encourage folks also that are watching today, if you want to learn about it, the illustrious, talented Derek Fair is popping in links to this as we
Oh,
talk, so you
great.
can visit
Great.
VASN on the web. You can learn about the bill. You can do other things there too. I'm going to pivot now because that seems to be the word that I keep using over the last 6 months.
Okay.
So we talked about school nursing and the challenges of a qualified person in the school, or maybe someone that is not necessarily in that role but has been put in that role of caretaker. Let's call them,
Mhm.
school nurse light, or school health professional. So it's important before COVID, right? Because you mentioned with ADA
Mhm.
and more complex health issues
Absolutely.
and allergies to all kinds of different things, and increase in asthma, increase in rates
Absolutely.
of autistic students that have certain
Mhm.
needs, because we know that those numbers are rising in
Mhm.
schools. So we know even pre-COVID that it was probably a good idea to have a school nurse in every school. I mean, right?
Yes. Oh, absolutely.
Now you've
Yes.
got the added dimension of what we've all gone through in the last five and a half
Right.
months, right?
Right.
The
Right.
world crazy shut down. You have virtual learning,
Yes.
you have hybrid, virtual and in classroom. Then you have in classroom.
Yes.
In the Richmond area, we're all over the map. We've got
Right.
totally virtual in some, like Richmond. You've got virtual moving into the classroom, like Chesterfield. You've got Hanover that, literally in a week and a half, their kids are going to be in the classroom.
Mhm.
Um, talk about the added value of a school nurse being in a school in the age of COVID.
Okay, I sure will. Um, I think going back to what your prior statement, it was a great idea to have a school nurse in the building before COVID. Now that we have COVID, um, it's it's is essential that each school building have a healthcare professional on site, have a registered nurse on site. The reason for that is screening for COVID or taking care of our kids, it's more than zapping their foreheads to see if they have a temperature above 100.4. Okay. And only an RN can assess the student's symptoms and their condition. Okay. The unlicensed personnel can't do that. What they can do is they can gather some data for us, but you need an RN in that building. Let's say I always pick on little Johnny. Little Johnny is coming into your clinic and he's not feeling well. Well, I guarantee the first thing school staff members are going to do is call that parent to come pick up that child to go home, especially in this COVID era. With having an RN there, that RN can assess that student to find out what is truly the issue. Is this an issue that we can perhaps refer to the student's health treatment plan if he has one? Call mom and dad, let them know, let them rest, send them back to class. Because the most important thing is we want the students to be in the school to learn. We want them to get that seat time and get that instructional time. We don't want to send the children home every time they come in the clinic, which is what happens when you get an unlicensed assistive personnel taking care of our children that are not able to assess the child.
Right.
Okay, and one other thing, with the RN in the building assessing, we also collect data. We collect symptoms. It's called surveilling. We survey every student that come in. We plot their symptoms. We work collaboratively with the Virginia Department of Health. So if we see a rise or what we call trending, some symptoms or trendings, we collaborate with VDOH. And that is key. That's the difference of containing a virus or having things explode and ending up in a shutdown. And I will just add this shout out to school nurses. It was a school nurse in New York that through her astute surveillance of her students and collaborating with the Department of Health in New York, and she reached out to the CDC. She was the one that spotted H1N1, and that made a difference between tracking, treating, containing this virus and a total shutdown, which we did not have in H1N1.
Right. Yeah, I think that and as you know, we've worked with VDH, and matter of fact, I was on a call with them earlier, and doing public advocacy campaigns out there to help in the age of COVID too, with the work that we're doing through the COVID Wise app. Appreciate you guys being a supporter of that program.
Yes.
And encouraging school nurses and other folks to download the app there too. I'll put in a plug for covidwise.org. It's a great analogy thing too, because one, it was a good idea pre-COVID, and now you said it's essential, and I couldn't agree with that more.
It's essential.
Right now, we've got literally, if you think about a public school system like Fairfax County, was it 160 or 180,000 students? You've got all the way down to like the fifth largest, Chesterfield, which is 60,000, 65,000 students. That's just an enormous amount of students, and if you don't have school nurses at each one of these school systems, is there a difference between like the larger systems and the rural systems? But do the larger school systems have a nurse in every school?
Well, that's a very good question. Fairfax County does not. Fairfax County Schools does not employ a single RN. They have what we call the public health model. They collaborate with Fairfax County Public Health.
Okay.
So one public health nurse who is an RN, a very qualified RN, will oversee health aides. Health aides are the staff that are in the 198 or 190 schools that are in Fairfax County. That's who the students see when they walk into the clinic. A health aide is someone who has a GED or a high school diploma and goes through 2 weeks of training with Fairfax County Health Department, and they're placed in a clinic.
Right.
So you have an RN that oversees a health aide. That RN may have 4 or 5 schools. So it's a challenge. I don't understand, and I
So,
certainly do not endorse the public health model.
so really, I think it's about getting RNs on the front lines as opposed to getting one RN that manages a whole bunch of health aides, right?
Exactly.
So,
Exactly.
so with that, okay, let's take Fairfax for the example. You said you've got 180,000 or 160,000 kids and 190 schools or something like that.
Yeah,
Let's say,
something like that. Right.
yeah. Or let's say take Chesterfield. I think there's 63 schools in Chesterfield, if I'm not mistaken. So 63 schools in Chesterfield. And let's say that there's maybe 10 school nurses right now. I don't know what the average. You got to hire 53 more, right? Well, that's money for the school system, right?
Yes.
That's the downside of the school system. So would this bill help localities with funding for the school nurses, or do the local localities need to kind of take that out of some other areas, or how does the funding work on this side of this with the bill that Senator Kiggins has put together?
Mhm. I don't know all the answers regarding the finances. I know fiscal impact studies were completed. Um, it's not VASN's position
Right.
to find the funding for this.
Sure.
Our position, our job is just to try our best to advocate for our students, and to let
Understood.
all the
Yeah.
decision makers, hopefully have all the decision makers understand, hey, our kids are worth this. Find the money. You
Right.
got CARES money. You can also find the money in Medicaid billing. Like,
Right.
it's a lot of people don't know some of the procedures that school nurses do in schools. We can bill Medicaid, and the school district gets money back from that. So maybe they can devote some of that funding
Right.
to also help fund this bill.
Well, the other thing to me also, it seems like in the age of COVID too, you have a lot of services and things that are just not being provided to school, to kids in schools right now, right? I mean, there's got to be some ways that you can do to fund this, because like you said, it's a difference between being a really good idea and now being essential. And again, we're getting into some areas there, the lawmakers have to figure out, how to make the sausage, right? They got to put all the
Yes.
things together,
Yes.
and hopefully how this bill makes it through. One, shout out to Senator Jen Kiggins. You mentioned her.
Yes.
She's from Virginia Beach. She's a nurse practitioner. I believe she was a Navy helicopter pilot as well. Is that?
She was a helicopter pilot. I'm not sure if she was Navy and Marine, so I do not want to
Well, I don't want to disparage her one way or the other, but hey,
Right.
that's pretty cool. Helicopter pilot and a
Yes,
and
it's
a
very
nurse
impressive.
practitioner. Well, then I look forward to learning more about her. A great idea there, kind of helping getting this push through. So as it's hard to look with the tea leaves. We're getting up on the 27-minute mark. We're talking about this because I appreciate you. And by the way, you've done a great job. All the information is really, really valuable today.
Oh,
And I'm so glad that we had the opportunity to do this. How can people at home learn more about the issue first, to get involved with the work that you do? So let's start with number one. How can they learn more about you and this bill?
Okay. If you're interested, you can log on to our website. It's Virginia Association of School Nurses.net. You can log on. If you have a student that goes to school, you can also reach out to their school nurse. But I would encourage parents and stakeholders right now, hey, pick up the phone, get online, email your delegate, your legislator, check to see the Senate members that are on the Finance and Appropriations Committee. Call them, let them know that they need to find funding for this bill. That is what is going to get this bill passed. It's not school nurses fighting. It is parents. It is stakeholders that are going to their legislator and pushing this very, very necessary legislation.
That's a good point. A lot of people, I think they understand who their congressperson is. They understand who their senator is in the Virginia Senate, or who the two senators are. Some of them don't know on a local level. Who is my House of Delegates member? Who is my state senator? We'll pop a link in there too, so you can basically look and find out who it is, because you want to make sure you're emailing or you're calling or whatever else the right person. But here's the thing: even if you get it wrong and you tell the delegate down the street or the senator over the hill, it can't hurt, right? I had an issue a little bit ago where I actually involved when one of my businesses in Lynchburg, I involved two different members of the Virginia Senate, because my two restaurants were in two different Senate areas, and it was amazing to find out that I didn't know until I actually went there. But I wrote them both, and they were both very helpful, and both of them had staff that wrote me back. And I found that Virginia legislators, because it's a part-time thing, that many of them are citizen legislators. They're going to get back with you. And so I do think that that's a good part. Number one, go to the website, read about this issue. If you think it's important, like Gina does, if you think it's important, like Madison+Main does, get involved. You don't have to necessarily have kids in school to think that this is a good idea, right?
It's a community. It's a community issue. It's all about keeping our community safe and healthy.
Yes. And I appreciate it. Man, time flies when I'm having fun and when I'm talking to you, Gina. Thanks so much. And thanks for the kind words from my staff here. We appreciate it. They work hard, and it's nice to hear when clients are happy, because happy clients make boss man happy. So I appreciate it. Thank you. And talk to the rest of your staff and tell them we appreciate the work that they do.
Okay.
We're going to keep our fingers crossed. We're going to see what happens in the next few days. And then we'll provide some updates on what's going on. So I would say check the newspaper, watch the news, get involved. This is an issue I think that a lot of people can rally around. So thanks for taking the time to talk to about it today.
Okay.
And, we will continue fighting for the Virginia Association of School Nurses.
And our school children of the Commonwealth. Thank you so much, Dave.
You got it, Gina. I'll talk to you real soon. Take care.
Bye-bye.
Bye.